a group with Emma Visser and Anissa Quintanilla, and we chose Subarachnoid Hemorrhage as our disease, also known as SAH. So just a brief overview of what it is. So subarachnoid hemorrhage is a bleeding in the space between your brain and the surrounding membrane, also called the subarachnoid space. So this bleeding usually results from the rupture of an abnormal bulge in the blood vessel, also known as an aneurysm in your brain. But it can also be caused by a couple of other things, such as trauma, an abnormal tangle of blood vessels in your brain, or other blood vessel or health problems. And SAH is also most common in ages between 40 and 65. So some of the causes of subarachnoid hemorrhage can occur spontaneously, and it is often related to just aneurysms, which are abnormalities within the brain's arteries. The most common cause of primary SAH is berry aneurysm. So, just as the name says, it's like little sacs on your cerebral vessels that look like a cluster of berries. So, and these aneurysms will swell up and weaken the walls of the arteries over time. Once the aneurysm erupts, it quickly bleeds and forms a clot, and this condition is normally responsible for most SAH cases. Other causes of SAH include AVMs, or arteriovenous malformations, which are defects in the blood vessels of the circulatory system. And some other causes include bleeding disorders and the use of blood thinners. Moving on to some of the symptoms of SAH. They usually don't appear unless that brain aneurysm ruptures. So once that rupture does happen, the main symptom is a sudden severe headache, which is more intense at the base of the skull. And people who normally have SAH will characterize this headache as the worst headache that they've ever had to experience. So other symptoms besides that main one would include neck or back pain, nausea or vomiting, feeling or being sick, sensitivity to light, blurred or double vision, slurred speech, sudden weakness, and also loss of consciousness or convulsion, which is just rapid leg shaking or uncontrollable shaking. And then to diagnose SAH, we will typically do a CT scan, an MRI scan, also cerebral angioplasty, a lumbar puncture, and repeated imaging. So a CT and MRI scan will be used in order to detect bleeding in your brain. The doctor may also do a CT angiogram or MRI angiogram, which is where they inject a contrast dye to view your blood vessels, arteries, and veins in greater detail. So, and then a cerebral angioplasty may also be taken in order to obtain more detailed images. So this process includes the doctor inserting a long, thin tube, also called a catheter, in your groin or artery in your leg, and threads it to your brain. So then the dye is then injected into the blood vessels of your brain to make them visible under X-ray imaging. And then the other processes, like lumbar puncture, is when the doctor inserts the needle into your lower back to withdraw that fluid that's around your spinal cord and your brain. And they will see if there's any blood present in that fluid, and if there is, that'll typically lead to SAH. And then for treatment, there are two main treatment options for SAH, and that is surgery and endovascular embolization. So surgery is normally done by the surgeon, and he will take the incision to your scalp and will locate the brain aneurysm. And then he'll put a metal clip placed across the aneurysm's neck to stop the blood flow to it. And then the last option is endovascular embolization, which is when the surgeon inserts a catheter into an artery in your groin and threads it to your brain. And then detachable platinum coils are guided through the catheter and placed in the aneurysm. So those coils will fill the aneurysm, reducing blood flow into the aneurysm sac and causing the blood to clot. So that's kind of what the picture on the slide shows, is that platinum coil clogging up the aneurysm. And then for prognosis and follow-up, the follow-up process really depends on how serious your SAH condition is and how much neurological injury you have. So for rehabilitation, it can be a very frustrating process, as you will make a lot of progress, but then you may also suffer a lot of setbacks. So it can be a very difficult process to go through. So the main process to go through after surgery is rehab. But there are a few cases after the endovascular procedure where they will sometimes need to do that surgery again, and then once that happens, your doctor will normally need to have appointments with you to make sure that there's no changes after that surgery, and just to make sure that everything goes well. For rehab, there are many specialists who may be involved in the recovery process, like specialists to help with your recovery from brain damage, which is very likely to happen, and then you also have physiotherapists, which will help with certain techniques, such as exercises and massages to help with your movement, just regain some of that movement back. And then you also have some language therapists to help you with your communication skills, as some of that may also be lost in this disease. So if you would like to find more sources, these are the sources that I used. So if you have any questions, you can also